afternoon, everyone. Thank you for joining us this afternoon on Facebook Live at St. John's. Today we're going to be taking some questions and we're going to try our best to answer them. We're going to be providing you an overview of our Wellness and Recovery Center. But first, I'd like to introduce the team. My name is Annie. I'm the clinical director of the program, and I am with St. John's on and off for over about 20 years. At the program, I've been the director for about 2 years now. And I'd like to introduce our psychiatrist. Go ahead, Dr. Isakov.
I'm Dr. Isaac Isakov. I'm working in the Wellness Recovery Center since 2011, I believe. But I am a psychiatrist working in New York since 2001. We probably will explain then later what our program does.
Okay.
My name is Jamie Taylor, and I am the intake social worker at the Wellness and Recovery Center. I've been with St. John's about 6 years, so I've been working here for quite some time. But I've been with Wellness and Recovery for about 4.
Thank you. So the program we are a larger staff. We are just 3 of our staff members. The program is a satellite clinic of the main clinic, which is the Community Mental Health Clinic, located on Beach 20th Street. Our program is located at 1908 Brookhaven Avenue in Far Rockaway, Queens. And it's right across the street, I'm gonna say across from the hospital's main entrance. We are an Office of Mental Health licensed program. We are available, we have walk-ins. However, we prefer that you make an appointment, and that if you decide to walk in, that you walk in before, I'm gonna say 3 o'clock in the afternoon. So Jamie is our intake worker. Jamie is a licensed social worker. Jamie sees all of our new patients in the clinic. So I'm gonna ask Jamie to give us a little overview about that, how that process works, so that people watching us can understand what that's like.
So generally, we ask that you can contact us and call us on our main phone, which is 718-869-8400, and you can they'll direct you to me. We do take referrals from inpatient clinics. We take self-referrals, referrals from detox. It doesn't really matter. We are really, the process to get an appointment is really quick. We can usually get you an appointment within 2 to 3 days max. So if you're trying to really start the process of outpatient therapy, we can definitely get you in really quickly. So you would contact us, we'll do a short screen over the phone, ask you some questions about your history, those kind of things. And then we will ask you possibly some insurance information, and then we can hopefully get you an appointment right away.
Thank you, Jamie. So one of our first questions is what type of services we provide. So Wellness and Recovery is able to provide individual, group, and medication management to our patients. Our patients need to have a psychiatric diagnosis, and they can also have a substance abuse diagnosis. They don't have to have both. It can be one or the other, or both. Primarily a mental illness, I'm going to say not only a substance abuse diagnosis. It's meant to be a higher level of care, meaning patients are for the most part seen more than once a week. We can see our patients 2-3 times a week. Most of our patients are participating in group therapy. It's not a once a week psychotherapy clinic. It's a lot more intense. And we can provide a lot of case management in addition to psychotherapy services. The hours of operation, 8:30 to 5.
8:30 to 5. We do provide group therapy daily. So some of our groups include an anxiety support group, schizophrenia support group. We do have a substance support group as well. And wellness, self-management, those are some
We
of
have
the
a relapse prevention group.
yes, some trauma, a trauma group as well, healthy living. So we do have daily groups that you can attend, in addition to the psychotherapy as well as the medication management.
It's easy to become a patient. You just need to call us. So one of the questions that we get asked a lot is, do you do detox? So I'm gonna ask Dr. Isaac that question that came in. Do you do detox?
Actually, it's very, very interesting question that a lot of people asking, like calling, right, to our clinic. I wanted to clarify what does it mean detox. To be eligible to detox or detox yourself, you need to be first of all intoxicated with something, right? If you intoxicated on alcohol or intoxicated on drugs, it's definitely, you probably will end up in the emergency room with acute intoxication. Or if you will walk to our office with acute intoxication, we probably will send you to emergency room because it's acute services need to be done when the person acutely intoxicated, like overdose with alcohol, overdose with drugs, or overdose with medication. It's emergency issues. It need to be taken care in emergency room. When in emergency room, they will take care of your acute symptom of intoxication and bring you back to normal condition. Then probably the question will be in emergency room where to refer you to continue your detox and to rehabilitate if you are willing to get through the rehabilitation process. In this situation, when you clinically, medically stable condition, you can come to us and we will help you to continue your detox process from drug or alcohol, and we have different approaches and different methods how to do it. We are providing with Suboxone maintenance treatment. We're doing the alcohol abstinence treatment with the Vivitrol once a month injection. It's we're providing the therapy as individual and the group therapy, relapse prevention therapy in our clinic. This is what I probably will say what for you to understand what is actually detox mean and what is the stages that you need to go through. I want to repeat again, if you're in acute state of intoxication, you need to be in emergency room, taking care of your medical condition which caused by drug or alcohol. When you medically stable, then continuation of detox and rehabilitation can happen in our office or in any other places that specify, specifically taking care of this. I hope that it's clear.
Thank you, Dr. Isaac. Is there a limit on how long a person can stay on, let's say, Vivitrol on Suboxone?
It's all depend of patient's treatment progress and the abstinence from drugs and alcohol, and if they have emotional condition that go together with the use of alcohol or drugs, they also need to be stabilized before you will consider that you can get off of the Vivitrol or Suboxone. But it's all will be decided between doctors and the patient, having this conversation if there is a risk to relapse or there is a minimal risk to relapse. Is the patient stable enough to maintain his abstinence from alcohol or drugs on his own without help of medication that are available and help of the treatment modalities that we provide? It's not just set time that how long it should be. In every person, I believe it will be different.
Right. It's very important to clarify that, because people don't always understand what detox and rehab is. Times have changed, and a lot of these services can be provided in an outpatient setting. One of the questions that came in is that, do you need to be diagnosed with a mental illness in order to be a patient at wellness? I'm gonna say, come in for an assessment. Maybe you don't know that you have a diagnosis, and that's okay. If you feel like, if you know you have let's say an alcohol abuse issue, or you developing an alcohol dependence issue, or you feel like you're abusing some substances, I mean, opioids is a big issue now, but you're not sure if you have a mental illness in order to participate in our program, it's okay. You can come in for an assessment. We will help you determine if this is what is the diagnosis, and if you don't meet criteria to be in our program, we will make sure you are connected to the right place, to the right clinic. That's what we are here to do. So Jamie, maybe you can answer this one. One of the questions is, do you need insurance to be a patient at wellness?
So we will not turn anyone away who is in need of services. But if you do not have insurance, we do have some options, such as charity care. We do assist you in referring you to trying to get insurance. But there's, we do try to do our best as far as trying to connect you to what's available. But we will not turn you away. So we will provide you with an appointment for sure.
Right. And if we don't accept your insurance, again, we will help you connect to a provider that does accept your insurance,
Yep.
If that's your choice. Looking to see any other questions that we have. What is intensive outpatient program? So Wellness and Recovery, in the last year we launched another track. We call it IOP, it's intensive outpatient, which is time limited intensive treatment. It's ideal for patients who are being discharged from an inpatient unit or transitioning from, let's say, an adult home setting into the community. And it's specific for the chronic population. So people diagnosed with chronic illnesses like chronic depression, chronic schizophrenia, bipolar disorders, substance abuse disorders. And the primary goal is to help people reduce risk of hospitalizations, stabilize the patient in an outpatient setting. How it's different from the regular track in our program is that patients can come and they can have up to 4 services in a day in our clinic, meaning they can attend, let's say, 1 individual therapy session plus 2 group sessions, and they can also see Dr. Isakov, all those services in 1 day, every day of the week for 6 full weeks in our clinic, and we will at the end of the 6 weeks then determine what's the right level of care after that. So it's an alternative for hospitalization, and it works very well for people who are prone to going to the emergency room a lot. The way we place people in this track is by assessing. So again, Jamie will see the patients and she will consult with myself, and we will determine, and the doctor determine if this is the right level of care for some of our patients. This is fairly new in our program and it's working very well. Again, we will provide this level of care to patients who are in need.
And I believe that it will help people to avoid hospitalization, to avoid to go to emergency room very frequently, to continue their treatment without going to the hospital or going to emergency room almost every day. And I think it's a great opportunity to avoid more costly or the treatment that patient doesn't prefer to go to the hospital. Usually our patient don't want to be in the hospital, and this is opportunity to avoid the hospitalization.
Right. Okay. Any other questions coming in? No? Okay, so I just wanted to maybe take a minute or two to reassure our patients that our clinic takes privacy, confidentiality very seriously. And when you come to our clinic, that is fully respected. When you call our clinic, feel free to share. You will probably be speaking with Jamie or myself. And if you don't want to do that over the phone, again, you can walk in and talk to one of us. Sometimes family members want to talk because they have loved ones that don't necessarily admit they have problems, and that's also okay. We cannot schedule your loved one for an appointment, but we can certainly give you information about how to get that done. So please reach out to us. We are here for you. And you can also, reach out to hotlines in New York City. There's lots of resources, lots of information. I'm going to repeat our number in case you need us. It's 718-869-8400. The hospital's main number is 718-869-7000. And you can ask the operator to transfer to Wellness and Recovery Center. And we will do the best we can to reach out to you as soon as we can. Thank you for joining us today.
Thank you.
Bye-bye.
Thank you.